Welcome. Hey everyone, thank you for being here. We'll be starting the webinar in just a few seconds. The reason I put these webinars together is because I've been learning a great deal of anatomy and the medical perspective on treating different conditions. And what I've noticed is in structural-based yoga therapy, we've known for years and have incredibly valuable tools and techniques that are effective in treating many different orthopedic conditions. However, these do not seem to be known outside of our yoga therapy circles. So I wanted to put this information together for you. And so here we go. I'm going to share my screen now. So welcome and thank you for attending today's webinar. I'm honored and thrilled to be sharing this topic with you. If you have any questions, please use the chat and I will respond at the appropriate time. So yoga therapy for structural issues of the knees and feet that medicine has no or relatively no non-invasive cure for. The topic will be specifically for flat feet, bow legs, knock knees, and knee hyperextension. And so typically the medical profession resorts to bracing, orthotics, or surgery, whereas in structural alignment yoga therapy, we have principles and techniques that have been experientially proven effective in addressing these issues for many years. And this webinar is designed for yoga teachers and yoga therapists, for yoga teachers and therapists in training, for dedicated yoga practitioners, and for those who refer their patients to yoga, such as healthcare professionals, body workers, wellness advocates, etc. And you're perfect for this webinar if you're passionate about working in therapeutic capacity and becoming an integral part of your client's self-healing, if you're eager to elevate your hands-on skills and verbal cueing with therapeutic alignment, you are in the right place. If you are ready to transform your personal practice and teaching into yoga therapy, and or if you're seeking to specialize in structural alignment yoga therapy. And the flow of topics will first cover the medical versus structural alignment yoga therapy perspectives. And some of this information will be relevant to all future webinars as well, which is why I started with the feet and knees, because they are the foundation of the whole body. Second, we'll cover the anatomy and biomechanics that's relevant to these conditions. And third, we will go over the key structural alignment yoga therapy applications and therapeutic repatterning exercises to address these conditions which have been implemented with great success. And I'm just going to switch to this version. Okay, this will be better. So first we'll cover the medical versus the structural alignment yoga therapy perspectives for these conditions. So the medical definition of flat feet. So basically this is from, I've given you the link provided here. Several tendons in your foot and lower leg work together to form the arches of your foot. When the tendons all pull the proper amount, then your foot forms a moderate or normal arch. And when your tendons are not pulling together properly, there is little or no arch. You can see the tendons in that image. We'll talk about those a little bit more later. And the medical test is to wet your feet, stand on a flat surface, and look at your footprints. So before I learned these structural alignment yoga therapeutics, my foot was somewhere between first and second degree, and now it would be considered normal. So it's pretty amazing. The common medical causes for flat feet: abnormality present from birth, stretched or torn tendons, damage or inflammation of the posterior tibial tendon, broken or dislocated bones, conditions such as rheumatoid arthritis, and nerve problems. The nerve problems would be because the nerve is not conducting to the muscle correctly, which is not firing and supporting the bones. Other factors would be obesity, which is going to put excess weight into the arches of the feet, diabetes, which will affect the nerves of the feet, aging, which will create some kind of degeneration in the bones, and then pregnancy, which the relaxin hormone through pregnancy creates a lot more laxity in the ligaments, and the excess weight gain will affect the arches as well. So the medical treatment, I've highlighted certain texts. You see where it's underlined, and then I've got like a little star and a number beside it. I'm going to look at this a little bit later when we look at the structural alignment therapeutic perspective, and we'll address each of those points in a little bit more detail and see how we can address them from another way, from the therapeutic way, yoga therapeutic way. Treatment for flat feet and fallen arches depends on the severity and cause of the problem. So if feet cause no pain or other difficulties, then treatment is probably not needed, and we will discuss that a little bit more later. In other words, your doctor may suggest one or more of these treatments: rest and ice, stretching exercises, we'll talk about those a little bit more later as well, pain relief medications, and physical therapy. Other treatments would be orthotic devices, shoe modifications, braces or casts, injected medications to reduce inflammation, and if foot or pain or foot damage is severe, your doctor may recommend surgery, which may include any of the following. So these are the surgical procedures: fusing the foot or ankle bones, removing bones or bony growths, cutting or changing the shape of the bones, cleaning the tendons, adding tendons from other parts of the body to help balance the pull of the tendons, and then grafting bone to your foot to make the arch rise more naturally. And then treatments, this is another from Wikipedia. So going barefoot, particularly overtrained, such as a beach, where muscles are given a good workout. And a medical study in India showed that flat feet was less common in children who grew up wearing sandals or slippers versus closed shoes. And this conclusion may be that intrinsic muscle activity of the arch is required to prevent the slippers and sandals from falling off the child's foot. So closed-toed footwear can be detrimental to the development of the arch. And ligament laxity is also among the factors known to be associated with flat feet. And so here's some medical home remedies. Wear footwear or shoe inserts that are appropriate to your activity. When pain occurs, try at-home treatment of rest, ice, and non-prescription anti-inflammatories. Ask your doctor or physical therapist to show you stretches. So we're going to talk about that a little bit more in detail later. Limit or treat risk factors that can make fallen arches or flat feet worse, such as diabetes, high blood pressure, and obesity, and avoid activities that put excessive stretch on your feet. So now let's just look at quickly the medical approach for knock knees, bow legs, and hyperextended knees. So bracing and or surgery treatments are recommended for structural conditions due to an injury or trauma, cases where a person's structural condition is causing pain and loss of functionality. The medical treatment for knock knees is basically to correct them. The entire leg must be treated. This is a physical therapy approach. Activating and developing the arches, waking up the outer leg muscles, and we're going to talk about that a little bit more from the structural alignment yoga perspective. It's a little bit more specific than what they're saying here. And learning how to move the inner ankle bone inwards towards the outer ankle bone and upwards towards the knee, which we will also address a little bit more in detail from the structural alignment yoga therapy perspective, among other things that we will add. And the general treatment, medical treatment, is also working with a physical medical specialist, such as a physio, and to improve the outcomes and use the leg muscles properly. And then alternative complementary treatments may include certain procedures from Iyengar yoga or Feldenkrais, which interestingly enough, one of the main teachers that I learned a lot of this from was an Iyengar teacher originally, and then founded Anusara Yoga Therapeutics, which is what a lot of my information is based on and evolved from. And so now for bow legs, generally no treatment is required for idiopathic presentation, meaning idiopathic means no known cause. And it's normal in young children, so treatment is only indicated when it persists beyond 3.5 years old. In the case of unilateral presentation or progressive worsening caused by rickets, it's important to treat the constitutional disease. At the same time, the caregiver is never to place the child on its feet, which I think is pretty controversial because we have a completely different approach in structural alignment yoga therapy, but we're just talking about the medical perspective right now. In many cases, this is quite sufficient, but it may require splints, and in older patients, either from trauma or occupation, the only permanent treatment is surgery, but orthopedic bracing may provide relief. Well, we know otherwise, which we'll talk about a little bit later. So the medical profession offers few options, if any, for treatment of these conditions when they are due to a person's normal postural misalignments. So like I said earlier, they're only really offering bracing or surgery when it becomes functionally, when it's affecting the person's function and when there's a lot of pain. But when it's just a normal misalignment, then it's not really being addressed. Okay, so now we're going to look at those highlighted points above. So here's those 3 points. So first one, if flat feet causes no pain or other difficulties, then treatment is probably not needed. Okay, so let's look at it from the structural alignment yoga therapy view. The foundation of the feet, of the body, the feet and arches, contributes to the alignment of the entire skeleton. So no pain complaints in the feet or arches does not rule out their potential role in pain in other areas of the body, nor does it rule out future issues that may be in the process of developing due to the flat feet. Doctors are not trained to see the big picture. The medical scientific view is segmental, separating the body into its anatomical parts and systems. MDs specialize in either specific segments of the body, specific systems of the body, or specific conditions. And it's not in the MD's scope of practice to look at how a condition may be related to another condition. Once they've diagnosed a condition, they will refer their patient to the specialist who treats it. And so from the SAYT view, we consider how all body parts are interrelated, and we recognize that any segment of the body being out of alignment will directly and or indirectly affect the whole body. We recognize that muscular and structural imbalances contribute to habitual overuse in isolated joints, faulty movement patterns, which creates repetitive microtrauma, leading to dysfunction and chronic injury. For example, postural misalignment compensations. If you have flat feet or fallen arches, this is going to create a chain reaction from the ground up. The shins will fall towards the midline and rotate internally. The knee alignment is altered, which puts a strain on the joint. The thigh bones internally rotate, which affects hip alignment, etc. So let's look at now the second and third point about the stretching exercises that the medical profession might prescribe, or it says to ask your doctor or physical therapist to show you stretches that can prepare you for feet intensive activities. So yes, they will be partially effective, but firstly, let's look at how these points may be a little bit less effective than what we can offer. So the medical prescribed stretching and strengthening will be targeted only for the segment of the body in question. This will not address the rest of the body that also needs stretching and strengthening. To have an overall balance in the body, first of all, and second, to deal with potential compensation patterns. However, the good news is more and more doctors are recommending yoga to their patients. So the simple stretching and strengthening will offer success. However, the success may be limited because typically these exercises are done without attention to or knowledge of optimal alignment and biomechanics. Stretching and strengthening is performed within the context of a person's habitual misaligned pattern, the same pattern that created or contributed to the condition that we are trying to alleviate. So note the alignment of the foot. In yoga, we call this alignment of the ankle, this would be sickled, like the shape of a sickle or a blade that you use in farming. This is not anatomically, biomechanically precise, and therapeutic and can cause misalignments in other areas of the body and compensation patterns. We'll talk about that a little bit more later, but that's just a great example. Physiotherapist exercises are segmental and simple without detailed biomechanics for optimal alignment. So look at the foot on the stairs, for example. This is a great exercise. It's actually one that I recommend to my patients and clients. However, the way that it's being done there is with no attention to detail, and the way we're going to be doing it a little bit later, you'll see how we can refine it and make it a little bit more effective. Plus, many therapists attest to the fact that most of their clients do not perform their exercises regularly, if at all. We cannot change our patterns using the same ways of moving and operating as we have been in the past, or we will continue down the same path. Furthermore, most people do not have awareness of what optimal alignment of their own body actually is, nor an idea of what needs adjusting, nor knowledge of how to adjust it. Okay, so here's an example. Here's the common stretch for the quads, just as I found that photo up above on the internet. In my structural alignment yoga therapy training, I give that same example to show, okay, here's how most people do this stretch. They sickle their foot. And then I have in the actual training this text here: if the foot is sickled, this misaligns the ligaments and tendons on the inner and outer foot and ankle. As we stretch the quads, this pulls unevenly on the ligaments and tendons of the knee, which can cause pain or strain. And we're also putting a block between the knees for various reasons, which I can explain later. In structural alignment yoga therapy, we align and activate the foot. So you can see the picture of the foot here looks quite different. And we align it in such a way that transforms this simple stretch into a powerful therapeutic action. So rather than just stretching the quads, we can have a positive effect on the arches of the feet, the ankles, shins, and the knee joint itself. And in structural alignment yoga therapy, we incorporate some osteopathic principles. So the osteopathic philosophy and treatment is based on 3 tenets, which summarize the holistic SAYT perspective perfectly. The first one is the body is a unit. The person is a unit of body, mind, and spirit. This is a recognition that we are physical, emotional, and spiritual beings, and each aspect affects the other. The second of the 3 tenets, the body is a self-regulating, self-healing, and health maintenance organism. The body is infinitely intelligent and knows how to heal itself. Nature is designed for homeostasis. Therefore, a holistic SAYT approach supports the body and assists by setting up the circumstances for self-healing. The body does the rest, especially if you're actually doing the exercises. And this is in contrast to the medical approach that is based on the premise that drugs and intervention are required to effect a cure. And for the record, I just want to be clear that I believe in and I'm grateful for medical intervention and drugs in certain circumstances when they are absolutely called for. However, there are many cases that, in my humble opinion, alternative treatment may be more effective and preferable. And the third of the 3 tenets is structure and function are reciprocally interrelated. Structure affects function and vice versa. For example, if we alter the shape of our rib cage and posture, this changes the function of our lungs and breathing. Likewise, if we change the way we breathe, our ribs and the surrounding tissues and posture will change accordingly. So similar to the first tenet, the body is a unit of body, mind, and spirit. In structural alignment yoga therapy, we have what's called the rubber band effect. After we adjust the body towards optimal alignment in a person that has held a pattern of misaligned posture or an injury for so long it may not hold, or it may hold temporarily and then spring back to its original position like a rubber band. And this rubber band effect may be divided into 2 important factors, science and subtle. So the science, the first one, musculoskeletal and fascial patterning. Our patterns are deeply ingrained into the fabric of our connective tissue. And then the more subtle, the psycho-emotional factors. Our patterns are firmly rooted into our personality and self-image. The psycho-emotional factors also considers causes for the rubber band effects such as insecurity. The newly adjusted person feels they are in uncharted territory. The physical shift does not yet match their inner self. So I found this really cool image on Google, and I just circled the key points here. So you can see the person on the left, their posture is really showing, somebody who's very timid and shy and maybe anxious. And then the posture on the right is somebody who's more confident. So this is, how the posture really goes with the inner self and vice versa. And the psycho-emotional factors for the rubber band effect also can be attachment. Their condition is part of their identity and how they present themselves socially. Their limitation may be providing a payoff in some way. So while it's not in our scope of practice to address psycho-emotional factors as yoga teachers, yoga therapists, we are mindful that if the client is seeking yoga therapy, it indicates they are open to change. And it's as important to work with the client's inner body, uplifting their spirit, as working with their outer physical body. And that when treating very old patterns, we need to make gradual, slow progress. And number 4, that it's important to stay within the client's comfort zone, emotionally and physically. And one thing that we can do that the medical professionals just typically do not have time for, and it's not necessarily built into their scope of practice, we can uplift our clients. We can speak to our clients with loving kindness. We can be confident in the therapeutic power of our methodology, and we can share our belief in their ability to transform. In structural alignment yoga therapy and osteopathy, we recognize Wolff's law. And this is developed by German anatomist Julius Wolff in the 1800s. And this states, bone in a healthy person or animal will adapt to the loads under which it is placed. So this is very important to understand for us as structural alignment yoga therapists. And I will explain why in more detail. The Wolff's law dictates that if loading on a particular bone increases, the bone will remodel itself over time to become stronger to resist that sort of loading. Bones and soft tissue tends to deform, or you could say form, along lines of force placed upon them. So here's an example. The picture I highlighted and expanded it, and you can see the hip bone on the left that I've circled has almost like a octagonal shape. And the hip bone on the right is a much more circular shape. So just from that alone, we think our right and left sides of our body are absolutely the same. We are completely asymmetrical. Not completely, but we are asymmetrical. We're not two completely different people, but we can be quite different on the right and left sides of our body. Just do that test where you put a mirror to half of your face, and you'll see you look like two different people. Well, all of our bones on our right and left, so from the feet all the way up to the head, are kind of asymmetrical that way. Here's another example I found. It's not related to the feet, but I couldn't find one that showed this well for the feet, but it just highlights the point that I'm trying to make about the asymmetries in our body. So if you look at the persons to our left of the screen, but their right shoulder, you can see the space between the clavicle and the top of the scapula and the top of their arm bone and the top of their humerus is quite a big space there. Whereas on their left shoulder to the right side of our screen, there's hardly any space. And so you can imagine how, if they raise their arms up over their head, it's going to feel different on the right and left sides. And then if you look at the sternum, which I've circled in the center here, you can see how their sternum at the bottom tip, it kind of curves to their right. So this is pretty fascinating. And I don't know if you can actually see, if I put my mouse here, so this bone right here, this protrusion on their humerus is quite prominent compared to the left side where it's more smooth and flat. It doesn't sort of jut out as much. So this is where the pectoral muscles and different muscles are attaching. And you can see how the pectoral muscles also attach along to the ribs here. So that, if you go back to that slide where you see that tennis player, for example, and he's going to be using his right arm way more than his left arm. So that's his sternum and that tubercle on his humerus are going to develop a lot more due to that additional stress and the fact that the pectoral muscle is working so much more than on the left side. So that just gives you an example of Wolff's law, and it's really good for us to understand that going forward to look at all of the material we're going to be covering. So whereas in structural alignment yoga therapy, it's built on so compared to the medical profession, which does not really have any expectation of or intention that they can really transform their clients with anything other than bracing or surgery or intervention. The whole model of structural alignment yoga therapy is built upon the expectation, the intention, and the knowledge that the client, with the support and guidance of their structural alignment yoga therapist, can transform their condition. And we're utilizing specialized exercises that have the potential and power to affect significant structural changes, and which are designed to balance and treat each individual patient's unique musculoskeletal pattern. And in structural alignment yoga therapy, we incorporate detailed biomechanics for optimal alignment, and we address the affected segment of the body as well as the whole body, including compensation patterns. This is a cool exercise, which I'll talk about later. As structural alignment yoga therapists, we provide a unique form of yoga therapy that blends science with the subtle, anatomy and biomechanics with the affirmation of the human spirit. And we are confident in the knowledge that the structural alignment yoga therapy comprehensive methodology heals the body of physical injuries, reduces recovery time from injuries, and prevents injuries from reoccurring. And that's because the musculoskeletal patterns are firing in a much more optimal way. So what makes SAYPs transformational is the therapeutic alignment principles that transform the body towards optimal. Specialized stretching and strengthening exercises are designed to transform the musculoskeletal matrix. And with focused activation of targeted muscle groups and fascial patterns, there's a gradual and complete shift. Okay, so we're going to look a little bit more now into the anatomy and biomechanics. So first we'll talk about the flat feet. And so we're not going to do a lot of anatomy, just what's relevant to discuss, the therapeutics really. So the feet have many bones and complexity, and misalignment in part of the foot creates a chain reaction misalignment through the whole foot. And also the whole posture is dependent upon and affected by the feet. So, any misalignment anywhere is going to affect the whole body. Flat feet can turn out, which can cause a pronation in the feet, and this will put strain on the ligaments and tendons that support the arch of the foot and ankle and may cause the bones to collapse, which will lead to heel pain or heel spurs, ankle, knee, hip, and pelvic pain from misaligned joints, lower back pain from the inability to absorb shock properly, and arthritis, which may develop over time. Each foot has 26 bones, which is a quarter of the bones in the human body, has 33 joints and more than 100 muscles and tendons. So we have the 7 tarsals, and it's important to note the medial cuneiform right here. So these are your tarsal bones, these are your metatarsals, and these are your phalanges, or your toes. So the medial cuneiform is the highest point of the main arch, and we'll be talking about that a little bit more later. So here's our arches. So the 2 distinct arches, the main one is the medial and the lateral, so the inner foot and the outer foot. And then the transverse arch, which is across points A to B here. Some people don't really recognize it as a true arch, but for our purposes, the main one between A and C, the medial arch, is the most important, and that's the one we'll be addressing mostly. But the lateral arch is also affected by but the therapeutics we're going to be covering is also effective for the lateral arch. So let's bring back the Wolff's law. So the bones will develop based on the tension and load placed upon them. Therefore, the tarsal bones will develop according to the shape of the adjacent bones, and according to the strength and resiliency of, or lack thereof, the tissues supporting the bone. So here you can see that medial arch again. And there's that most, you got the heel, the calcaneus, the talus, which is what the shin bone sits on top of, the navicular and the cuneiform, and then your metatarsals and phalanges. So that's your medial arch, and then the lateral side, you've got the cuboid, the most lateral cuboid, and the calcaneus, and then the metatarsals. And so due to the total body's weight being loaded on the feet, the bones of the arch require reinforcement to prevent it from collapsing. In addition, the arch needs a certain degree of flexibility in order to provide shock absorption and to allow the sole of the foot to conform itself to the shape of uneven surfaces, like walking on rocks or sand or anything like that. So the feet have to be very mobile and yet very strong and supportive at the same time. So this additional support and flexibility is provided by muscles, ligaments, and tendons on the plantar surface, which is the sole of the foot, that provide tensile strength combined with elasticity. So here's the main plantar fascia at the bottom, and then we have these important ligaments that help to support, which we'll talk about in a little bit more depth later. I've circled them. Flexor hallucis longus is this one right here. And then we've got the flexor digitorum longus, that goes under here. And then you've got, as I said, you've got the plantar, you've got the long plantar ligament, and you've got the plantar aponeurosis here. Okay, so now we're going to look at this cool image I found. And this shows the different aspects of how we can think of an arch structurally, which is really cool. So you've got the keystone right here. And that would be the talus bone, which is the one, like I said, the shin bone sits right on top of here. And then the staples, so this is holding from underneath. The staples would be your short plantar ligament, your long plantar ligament, and the calcaneo-navicular ligament, which is right there. And then you've got a tie beam, which comes and holds across. This is your flexor hallucis longus, that one that I showed you earlier. It's another image here. And then suspension from above would be your peroneus longus tendon. So that's it from the lateral side. And so then the main muscles that assist with the arch are the tibialis anterior. So here's your tibialis anterior, and that actually comes from the lateral side of the shin bone, but it comes and crosses over to the medial side. Your peroneus longus, which comes and stays on the lateral side. And then your tendon of the extensor hallucis longus. And then the extensors and flexors of the feet themselves. Okay, so here's another great image I found on Google, tendons of the muscles that attach under the foot and support the arches. So here's your tibialis anterior. So it comes across, as I said, comes along into the medial. And then you've got your tibialis posterior, and they both attach right here at that medial cuneiform that we looked at. And your flexor digitorum longus, so that's coming along here. And then your flexor hallucis longus, which is your flexor hallucis. Your hallucis is your big toe, and the digitorum are the other four toes. So here's another great image. Thank God for Google. Fibularis longus, so that's also peroneal, and fibularis is the same word, just in anatomy at some point they decided to give it another word. So that comes along the lateral side. So this will help to lift the lateral arch, and then you've got all the others that help to lift along the medial arch. Okay, so here's another concept that is quite unique to yoga. At least I thought it was, and I will explain this from two perspectives. So the feet are the foundation of our body temple. This is something we talk about all the time in yoga. The body is a temple. But we're going to actually look at this structurally as well as sort of metaphysical, spiritual, esoterically. So when we lift our toes, this lifts the diaphragms and the domes of our body. So here's a great image I found of toes flat. And then you see the difference when the toes are lifted, how the arch lifts. So what I discovered in osteopathy is we have a really cool teacher who has a vast amount of information from from very many modalities, and she explained to us how the body has 8 diaphragms. This is something that's not really well known or taught in many circles, and I couldn't even find a Google image for these 8 diaphragms, but the closest thing I could find were the major and minor chakras. But they actually correspond to the diaphragm. We're talking about physical diaphragms, not just the energy centers of the chakras. So here's our chakras image again, but these 8 diaphragms are the arches of the feet, start from the ground up, the knee, so the knee joint itself is another diaphragm, the actual pelvic diaphragm, which we know as the pelvic floor, is another diaphragm, the main thoraco-abdominal, the respiratory diaphragm that we know, which is the, under the rib cage. And then we have what's called the thoracic inlet, and that's, the top of the collarbones and the scapula, so the whole opening of the neck there, that is another diaphragm. The occipital bone on the atlas, so where the head sits on top of the spine, that's another diaphragm. The pituitary diaphragm, and then the actual crown of the head, crown chakra, but inside the skull, it says tentorium cerebelli. And these all affect lymph and blood flow and energy flows and hormones and everything in the body, which is really cool. And so the arches of the feet are, that's why I started from the bottom, the arches of the feet. When we lift the toes and lift the arches, it lifts all the domes, aka the diaphragms of the body. So wherever you're sitting or standing, if you lift your toes, you'll actually feel your arches lift, and you might notice your whole posture has a little shift and your breathing will change. Okay, so now ligaments and fascia supporting the bones of the arches. The plantar fascia is a fibrous ligament-like structure that runs from the calcaneus, the heel, to the bases of the toes. And so when we lift and extend the toes, this tightens and pulls on this plantar fascia and deepens the arches. So here's that image again that we used earlier. So the toes flat, toes lifted, showing that arch. So what's actually happening here, when we lift the toes, yes, it's affecting the ligaments and muscles and everything else, but it's like a bow and arrow action. So when we pull on the string of the bow arcs. So when we pull on the plantar fascia, this acts like the string, and the tarsals and the metatarsals bow upwards, and it's so cool. And just by doing this, when I first learned this, I had very flat feet, as I mentioned earlier. Just by doing this, I would do all my standing poses with my toes lifted, and over a few weeks, I started to notice the change in my feet, and over time, it actually completely fixed my flat feet. Okay, so let's talk about the knock knees now, and the bow legs, and so the knee joint. The knee joint is made up of the femur, the tibia, and the patella. The fibula, which is on the side of beside it, is not actually weight bearing, and it's not actually in the actual joint. So the ligaments that hold the joint together are the anterior and posterior cruciates and the medial and lateral. So there's your anterior posterior cruciate. They make an X. That's why they're called cruciate, like a cross. And then the lateral and collateral. Those are medial and lateral. And then you've got this sort of disc shape type of thing here. You've got your medial and your lateral. Medial on the inside, lateral on the outside. Kind of like the lunar, semi-lunar shapes. And then we also have the patellar ligament. Some books will call it a tendon. It's a tendon or a ligament, and it's basically the continuation from the quadriceps. The tendon from the quadriceps goes through the patella and attaches below at the top of the shin. Okay, and then the main muscles are the 4 quads, which are on the front, and the 3 hamstrings, which are on the back. And so there you can, this is a really good image again. You can see the quadricep muscles, how they all of them, their tendon attaches through the patella and then inserts below at the tibia. And then you've got here your IT band, which also comes and inserts and attaches at the top of the tibia. And then here, you look at from the back, you've got some of your hamstrings. 2 of them, the semimembranosus and tendinosus, attach at the if I was to show you, so it would be like about here. It doesn't show, you only see from the back, but you can't see. It's actually attaching on the tibia on the medial side, and then you've got your biceps femoris, which attaches on the lateral side, and then you've got your gastrocnemius, your calf muscles come up and attach and split and attach medial and lateral. And then you've got your popliteus, which is crossing from the medial to the lateral side. Okay, so we'll talk about those a little bit more later. So let's look at the biomechanics. So as we know, when the arches are not properly supportive, there's a seesaw compensation that affects the tibia and the femur above. The Q angle is something we need to understand a little bit about. So in general, this is the angle that's running from the femur. If you follow the actual femur bone itself, and then if you look at a vertical line through the tibia, so that's your actual angle. So women have a larger Q angle than men typically. So here's normal if you have a very straight leg, and then this would be an increased Q angle. So that would be like for knock knees. And here's another image of it. And so here's another image. Whoops. There we go. There we go. So this would be the knock knee, and then this would be the bow leg on the right side of your screen. So both of them, excuse me, are putting undue strain on the knee joint, whether it's on the medial side or the lateral side. They're both affecting the knee joint in an unhealthy way. Okay, so there is an imbalance of muscular tension on the inner and outer legs with knock knees and bow legs. So on the picture on your left, which is the knock knees, there's an increase in tension on the outer legs. So what that means is from here to here, if I imagine, like, go back to that the bow and arrow, if I pull stronger on this side, it's going to push the knees out this way, and this is not able to pull it together. And then go with bow legs. Now we've got too much pull and tension on the inner leg, and then not enough pull and tension on the outer leg. So we can balance this out. So for knock knees, the abductors, ABD, abductors, and the lateral hamstring are overpowering the ADD, adductors. And then for bow legs, the adductors and medial hamstrings are overpowering the ABD, abductors, if that makes sense. So yeah, so that's the main thing we just need to understand, and then we'll bring that back when we come to our therapeutics. So now we'll look at the hyperextension of the knee. So when people hyperextend the knees, or any joint for that matter, they are hanging on their joints and ligaments. The surrounding muscles are not firing. So yeah, any joint that you're not engaging, you're going to have that situation where the muscles are not firing. So let me just move this. Okay, so now I'm going to switch slides. Okay, so this over time can lead to other issues as the body tries to compensate. So here's a great image I found, and it's just showing, if you look at the third image, the knock knees is mentioned here. And then, so this is like a seesaw. The top of the shin goes back, the top of the thigh goes forward, the pelvis shifts back. Everything is affected above and below. And so now we're going to look at the knee locking mechanism. So during the last 15 to 20 degrees of extension, when you're straightening your leg, that last bit before the leg is completely straight, with the foot free, meaning if you're not standing, if you're just sitting and your leg is free, the tibia rotates externally and locks into extension. When the knee extends with the foot planted, the femur internally rotates. So between the top and bottom of the knee, there's this little rotation. So we know that the knee is a hinge joint. It flexes and extends, but there's a little bit of rotation that I thought was pretty interesting when I discovered this. And it's the popliteal muscle that unlocks the knee. So remember that popliteal muscle is showing it here. So that pulls and helps to bend the knee. So here's a great image. So we've got our ligaments, and when the knee is, so this would be relatively straight, but imagine now if you start to go beyond straight, this is going to put a lot of tension and pull on those ligaments. And you can see when the knee is more bent, the ligaments are more slack, and then when it's straight, it becomes tight. But if you go beyond to hyperextension, it's going to put even more tension on those ligaments. So medically speaking, normal postural genu recurvatum hyperextension is usually not seen as problematic. However, as we saw with fallen arches, compensation can be causing other structural issues. Increased knee hyperextension has been found to be a predictor of ACL injury. This may be due to the laxity in the hamstrings. As I mentioned, they're not firing, they're hanging on the joint, causing them to become elongated, or from increased anterior glide of the femur on the tibia. Hyperextension puts increased compression or strain on the ACL and PCL. It puts compression on the anterior medial aspect of the knee, and it puts strain on the posterior lateral aspect of the knee, and the popliteal muscle tendon is strained as well. So now let's look at the therapeutic applications of structural alignment therapy and some exercises. So I'll give you a few samples of great things we can do. Okay, so first we have what's my SAT formula, structural alignment therapy. So we have stretch and release the tissues around the bones so they can articulate freely. So in order to do anything, first we have to make space. Then we align the musculoskeletal system biomechanically with the therapeutic alignment principles. So first we make space, then we align, we change the actual musculoskeletal alignment, and then we tone and strengthen this new optimal musculoskeletal pattern with appropriate functional exercises, and this equals transformation. So let's look at the first component, which is stretching and releasing. Actually, what's kind of cool is many of the exercises that we do have a stretching and strengthening component combined, and we want to do that with our alignment. So this one's just really actually more for the feet and the toes. So you're leaning back and you're lifting up your knees as much as, not everybody can do it to that degree, but you're just getting a nice stretch on the dorsal, which is the top of your feet, and then you flex the other way, and you get a stretch through the back of the feet on the plantar side, and then you can lower your knees, which puts a little bit more stretch. So when your knees are up, you're also balancing and strengthening, and then when you lower your knees, you're getting a little bit more stretch. And then that exercise that we looked at earlier, which is the heel raising and lowering. So this is good for opening up the fascia on the back and front of the feet. It introduces a new optimal movement pattern and strengthening. It helps to strengthen the feet with weight bearing, which is more effective than non-weight bearing. But here I'm showing you on the left with the arrows, see how my arches are collapsed in. And this is typically the way I would do it if I was not consciously trying to do it any other way. And this is typically how most people do it because I've seen many clients doing it. And so we just sort of drop down to our greatest flexibility and the ankles and arches fall in. So on the picture on the right side of the screen, I'm actually consciously lifting my toes up and consciously keeping my inner and outer ankles balanced and not letting the arches fall. So as we go up and down, raising the heels and lowering the heels, we're doing it with a new pattern. So here I'm going to the other extreme. Instead of lowering, now I'm raising up the heels. And then on the left, I'm letting my heels go as far up as possible. I'm going to the point of that sickling position that I mentioned earlier that creates that sort of curved. And so you can see how if I drew an arrow from my middle of my ankle, it's nowhere near aligned with my second toe. Whereas on the picture on the right, my ankle is more aligned with my second toe. And so I'm maintaining that optimal alignment as I go up and down with my heels. And so here is Kim, who modeled for us in the Structural Alignment Yoga Therapy online course. So some of these images are from that course. And so this is her feet naturally relaxed. And her arches are naturally relaxed, but she brings her feet parallel so that the middle ankle is lined up with the second toe. And we bring the feet hip distance apart, which means the middle of the ankle is under the anterior superior iliac spine, or the ASIS bone protrusion of the pelvis. And then we lift the toes. So I did not say anything to Kim, but you can see her left foot, which is on our right side of our screen. Her left arch and ankle is a little bit more in and drop down. So she would need to fine tune and micro adjust and lift that up a little bit more and press a little bit more into her outer heel on her left foot. But then we need to plant the four corners of the feet. Big toe ball mounds first, then the inner heels, and then the baby toe ball mounds, and then the outer heels. And so here you can see the foot on the left of our screen is without any therapy. She's a pretty good arch, actually. But then when the toes lift, the arch, that bowstring analogy we used, you can see how that really lifts up. And over time, this literally starts to shape the muscles, ligaments, and bones, and it starts to become more permanent. And then here's another really great exercise. So this is supine, and this is great for clients that fatigue easily when standing, or clients that have had recent surgery and cannot bear weight. So it's doing the same actions, lining the feet parallel, middle ankle to second toe, lifting and spreading the toes, and then we put the block for some extra additional activations. And we ground the four corners of the feet into the wall. Big toe ball mound, inner heel, baby toe ball mound, and outer heel. And then here's another one. Thigh, calf, and hamstring stretching, aligning, and toning. So we're doing everything at the same time here. When that exercise that we talked about a little bit earlier with the quad stretch, so we're activating the toes, we're unsickling the foot, and we're stretching the quad, and we're putting the block between the knees to squeeze in, which helps to align everything even more optimally in therapeutic. And then we stretch the back of the leg by lifting the foot up onto a rolled up blanket, which puts extra stretch on the plantar fascia. We lift the toes, we line up the feet parallel, we ground the four corners of the feet, and we do all of this with those optimal alignment to stretch and strengthen, creating a new pattern. Now let's talk about the knock knees and bow legs. So after stretching, we align and establish optimal foundation of the feet and arches. Then we tone, so it's the SAT, stretch, align, and tone, applying shins in and thighs out. I already have a YouTube video on that you can watch in my YouTube videos. And so the arrows here are pointing, this is where we hug the block, the shins move towards the midline, and then the upper block, we're actually trying to move the upper thighs away from the midline. So it's a kind of an opposite two things happening, and it's really amazing because it's helping to balance out the fascia above and below the knee. So as I said, shins in is drawing isometrically toward the midline. There's no actual change in the position of the legs. This is an action, and the block is helping to not change the position of the legs. And then meanwhile, the thighs out is drawing the thighs away from the midline, and we actually add an internal rotation of the thighs, which helps to move the inner thigh bones in, back, and apart. So we apply the same technique, shins and thighs out, for both knee conditions, for both knock knees and bow legs. We just do it in different, slight different forces. So for knock knees, the force of the action has to come a little bit lower and a little bit higher. Because the knees are moving towards the midline more, so we want to make the lower, below that midline of the shin, it makes think of like a seesaw principle. If we push this in, if we move this in, this is going to move out. So the feet and lower legs hug in more, and then we widen. Instead of moving just the upper thigh, we try to widen from like the middle of the thigh. You don't want to actually torque on the knee itself because the knee is not designed for that action. We have to do it from above and below the knee safely, but we just make it as far down to the ground as possible, and as close to the knee as possible without putting direct force on the knee, because the knee is more delicate. And then for the, here we go. So for bow legs, because the knees are wider at that midpoint between the legs, we want to draw more on the upper shin, not the knee itself, but the upper shin. And then the instead of widening from close to the knee, we try to widen way out above at the upper thigh. And I know this works. I didn't have bow legs. I had knock knees, which have actually been improved greatly. And a teacher / colleague friend of mine who had quite an interesting case of bow legs, I saw him transform his bow legs doing this over a period of 6 months, and I was shocked to see from when I saw him to the next time I saw him, over a period of 6 months, it was completely transformed. And it was him that actually initially taught me this, but I've added this fine-tuning of where you draw the force, which is a little bit different than just doing shins and thighs out the same way for all conditions. I've just fine-tuned it a little bit to address, because I know for me, I needed to do it a little bit differently for knock knees, and then for bow legs, you do it just, again, you fine-tune it a little bit. And now for hyperextended knees. So you can see in the picture on the left, I've moved so you can see the slope there, how my knee is behind my ankle. So first we need to get the shin vertical. And we need to get the feet aligned. So we got to have the second toe to the middle ankle. We have to lift the toes and lift the arches. We need to bring the shins vertical. And then third, then we apply the shins in and the thighs out. And as I mentioned, the shins and thighs out balances the musculoskeletal fascial patterning above and below the knees. So once we do that, then we bring in this new exercise with this new pattern. So the therapeutic exercise for another one that I like to do is to put a block behind the shin in standing poses where we have a straight front leg. And this supports the integrity of the entire posture by allowing the rest of the body to find a new optimal musculoskeletal pattern now that it no longer needs to compensate for the lack of stability in the foundation. Increased stability in the foundation allows for greater freedom overall. So if we didn't have the block and the knee was hyperextended, the rest of the body would have to try to compensate to create safety, because the body will recognize that unstable knee is unsafe. So other areas of the body will be trying to tighten up to compensate. So here's a great exercise as well. We sit, and not only do we align the feet and legs as we've been talking about, but we actually create resistance with the floor. So we press the heel into the ground, and we isometrically draw the heel back, which when you do that, you actually feel your knee will want to bend. So one thing you don't want to do is try to push your knee into the ground. You actually want to isometrically drag back into the heel and fire up the hamstring and calf muscles that actually lift the knee away from the floor, and keep doing that over and over and over again, but with the optimal alignment of the shins and thighs out and the feet activated. And this is going to actually start to change the hyperextension of the knees. And then I have a YouTube video for this as well. This is the shins and thighs out. So once we have those activations of the feet, the arches, the shins, the thighs, and then we slowly bend the knees and straighten the knees, not to completely straight and not to the full maximum bend, but just go through a nice comfortable range of motion, keeping the shoulders back, keeping the spine neutral, and starting to retrain a new musculoskeletal pattern throughout from the foundation up. So once the arches are lifted, this is going to start to change everything all the way up. And so those are the samples of the therapeutic techniques. Thank you for attending today's webinar. I hope you've enjoyed the material I've put together for you, including the examples of how we can treat and transform issues of the feet and knees with structural alignment yoga therapy. If you've enjoyed this webinar, you'd be perfect for the SAYT online course, which teaches you how to turn your passion into a reality to work in a therapeutic capacity and become an integral part of your client's self-healing. Teaches you to elevate your hands-on verbal skills with therapeutic alignment, to transform your personal practice and teaching into yoga therapy, and to specialize in structural alignment yoga therapy. The online course contains 10.8 hours of video lectures with detailed instruction, including the theory and principles, how to apply hands-on techniques for optimal therapeutic effect, how to assess static and dynamic postural alignment, anatomy and biomechanics for each segment of the body, specialized exercises and yoga poses for specific conditions, and step-by-step guidance applying the techniques. And there's a 125-page workbook complete with images, theory, and the step-by-step instructions. The workbook and video lectures are downloadable, so you will be able to access the course content anytime. It's a completely self-paced online course, and you decide when you start and finish. And after enrolling, you have unlimited access to this course for as long as you like across any and all devices you own. Thank you for participating in today's webinar. I hope you enjoyed this presentation. If you have any questions or feedback, I would love to hear from you. And if you would like to check out my additional webinars and videos, please go to my YouTube channel, Karen Claffey. I look forward to sharing with you again. Until then, I send you love and light.